Hi, this is Nicholas Fogelson from Northwest Endometriosis and Pelvic Surgery. I had a interesting thought I wanted to talk about, which I've thought about a lot, is that it's the idea of positive and negative effects of things you might do to fix problems you might have, and what should be the focus of your decision making, in my opinion. Where this comes from is a lot of times a patient will come to me with a given problem, and I will present a potential solution that, based on my experience, has a good chance of helping them. And the conversation that ensues with some people, not everyone, is, well, what about this side effect? What about that side effect? And and then it leads to them rejecting what I have to suggest. And so I want to talk from a global point of view, like, does that make sense? Should we be ultra focused on side effects, or should we be focused on the potential benefit we may get from something? I think that, like, it's something about humanity or something that we have a tendency to focus on the unknown negative as opposed to the known positive. And we have this all over the place. I mean, clearly in vaccines, people are, a subset of the population is very, very focused on a really nebulous, unknown negative where they say, well, you can't prove something isn't healthy, or you can't prove something's not dangerous, and not focused on the provable benefit of doing something. So in the case of vaccines, there's a provable benefit of taking a vaccination to prevent, for COVID, preventing at least the severity of COVID, if not the transmission to other people. But they rather focus on a very unknown negative of something that something isn't fully tested or something. And, like, logically, does that make sense? Like, why are we focusing on a unknown, potentially negative thing, but probably isn't even real, instead of the very, very known, provable, established positive of doing something? I'd say the same thing about medical therapy for various therapies. I mean, obviously, I deal with pelvic pain and endometriosis a lot, and sometimes people are very, very resistant to trying any medical therapy. Now, I don't tend to use medical therapy a lot because most of my patients have already tried it and it hasn't worked for them. But sometimes people are very resistant to even trying because they're afraid of the side effects of that medical therapy. And it's like, well, I mean, the question is like, where does it come in about what is the potential benefit of doing something? And why are we so focused on a potential negative side effect rather than the potential benefit? Particularly that there are certain kinds of interventions that are completely reversible. Like, let's just take the example of taking birth control pills. If you're having pelvic pain issues, and for some reason that's the path one is going to take. I mean, again, birth control pills don't remove endometriosis, but nonetheless, if you had pelvic pain and you thought, maybe I want to try to make it better with birth control pills, people say, well, I'm worried about the side effects of the birth control pills. I'm like, why? I mean, why not focus on the fact that it might make your quality of life better? And if it doesn't, you can always stop it. You can always go off of it. Like, there are very few medical interventions, as far as medical, I mean taking medicines, that aren't entirely reversible when you stop taking them. I mean, your liver and your kidney filter this stuff out and excrete it. That's why you have to take medications every day. Like, if you take blood pressure medicine, it'll lower your blood pressure for 6 hours, 12 hours, depending on the duration of the medicine, maybe 24 hours. But eventually your body will destroy this medicine and excrete it out of your kidneys, and then it's gone. That's why you have to take it every day. So worrying that a medication is going to have some side effect is kind of irrational, given that you can take something, ask yourself the honest question, is this improving my quality of life? When it comes to pain, you can say, is this improving my quality of life? Talk with your physician about what is a reasonable amount of time to make a determination, because their expertise is going to be helpful in knowing, okay, what is reasonable? Like, for the example of birth control pills for pelvic pain, probably you should try it for a few months before you decide if it's really helpful because of the nature of the menstrual cycle and so forth. But at that point, you say, is this helpful? Is it not helpful? And if it's not helpful, then quit. And you haven't really lost a whole lot in doing that. The same would go for, say, someone that's having a psychological issue, and that there may be a benefit for psychotropic medications like antidepressants or anti-anxiety medication. And people go, well, I'm so worried about the side effects. I'm like, well, that's fine. You can still try it. and give a reasonable amount of time to determine, is this helping me or not? And if it's not, then you can stop. And then it'll be gone, and whatever, you'll be back to the state you started in. I think the same goes for certain kinds of interventions. Now, where we start to get, have to think about it more is when are there situations where there are irreversible consequences of doing something. And so surgery actually does have irreversible consequences. I mean, you're creating scarring, you're creating inflammation. And so you really want to have a very, very good reason to operate on someone. You want to have a very good suspicion that it's going to be helpful for them. And that's where a physician comes in, doing a careful exam, doing a careful evaluation, and really determining, hey, is this going to be helpful? But even in surgery, sometimes people are really focused on negative side effects. Like I have a patient that has I've had patients that have crippling pelvic pain, and their uterus is messed up with endometriosis as well as all the other endo in their pelvis, and I suggest that they have a hysterectomy along with removing endometriosis. And they say, well, I don't want to do that because I don't want to damage my sexual function. And I'm like, well, first of all, the data would suggest that's not real, and that on the average, it doesn't damage your sexual function to have a hysterectomy. But at the same time, we're talking about a potential negative downside that probably isn't real, unlikely to actually happen, versus the very known upside. And I'm not saying that the decision to not proceed with that surgery is irrational. I mean, I think that if you weigh those benefits and losses, your benefits and potential negatives, then you can make a rational decision on what you want to do. But you just got to make sure that when you're weighing that you really give the potential upside the weight it deserves. And I think that sometimes people don't do that. I think that people put too much weight on the potential negative of an intervention and not enough weight on the potential positive of an intervention. Now, sometimes that will get flipped in the wrong direction too. Like I think that people that have let's say they have a laminectomy to address Tarlov cysts. That's a condition where people have small little bubbles in their dura mater over the top of their nerve roots. Nobody really knows if these things cause pain. There are some data to suggest that they don't seem to cause pain, yet some people go on to have a really radical invasive surgery that involves carving up their bone and their sacrum in order to address these things. Like, to me, the potential downsides of that are massive, and the potential upsides are incredibly unproven. And so, like, to me, I would go, that's a downside I would seriously take into account. Like, it's heavy, it's known, it's established. And then versus the very unlikely upside. And so it's sort of weird. There's something about humanity, or there's something about our very nature that makes us be influenced by the unknown rather than the known, even on both sides of a decision. Like when we really know something has a big downside and yet there's some unknown benefit, somehow we're attracted to that. And when we know that something is probably going to be helpful, but there's some unknown downside, somehow we're attracted to the downside part of that. And it's just weird. It's something that I've noticed, and I just think that it's helpful to be aware of, that probably we should be more influenced by what we can really know and prove about a potential path, and less influenced by the things that are kind of nebulous. And that's my thought. So when you're choosing like how to move forward in a particular treatment path, I would try to be more influenced by the things that are really clearly understood and clearly known, and a little less influenced by the things that you just don't know, because to me, that's probably the best way to make those decisions. Thanks for listening.